Chamber Live on Facebook Live. I am Christine Kernan, Vice President of the Princeton-Mercer Regional Chamber, and I'm pleased to have as my guest today, Gene McGuire, Managing Partner at Wellness Coaches. Gene will be discussing how to navigate the world of COVID-19 and staying safe and healthy, and what companies can put into place to assist their employees with wellness practices to ensure a happy, healthy workforce. Gene will be taking questions towards the end of the broadcast, so please feel free to play your comments in the newsfeed. Welcome, Gene. How are you?
Christine, pretty good today, thanks. How are you?
Good, good. So tell us a little bit about Wellness Coaches, what you do, where you're from.
Sure. So I'm actually a native of Mercer County. I've lived in Princeton and Lawrenceville for quite some time. I've worked way back for Bristol Myers Squibb, Novartis. My background's in pharma. And then we started this company in 2002. And I was drawn there because although I was in the healthcare field for quite some time, my passion was always to be healthy, help others to be healthy. So it was a lot of fun to get involved in this in 2002.
Oh, wow. Well, that's very impressive. You have a very nice long resume. So tell me a little bit about the people that you're helping. I'm sure you're helping a lot of people live very healthy lives.
We are, and it started by accident, actually. When we first started this company, we were in the injury prevention space, and it was a pretty simple model. We had athletic trainers. We found people with great personalities and the right skill sets to help folks to be safer at work, prevent injuries, slips, chips, falls, sprains, and strains mostly. And they really had a passion for helping folks to really feel better about themselves. So we deployed them, and quickly injury rates dropped, and things went really well. But the light bulb went off for us when we were doing that. Folks started asking a lot of questions about other things they can do in their lives to be healthier, and our folks started helping them with that, as well as all the injury prevention work. And that's kind of how it got started, and everything evolved from there.
What type of companies, just out of curiosity,
Sure.
What type of companies were you helping back then?
Yeah, so back then we did a lot of work in distribution. So Conway Freight was one of our clients, Roadway Express, Roadway Trucking. We started getting involved in a lot of manufacturing businesses. We then got into the healthcare field, hospitals, nursing homes. So I don't think there's a business now that we're not in, but it all started in trucking.
Okay, great.
Yeah.
So what are the most popular areas of coaching?
Yeah, the top 3 or 4 haven't really changed even since 2002. Most folks are really interested in learning how to eat better, being more healthy in terms of what they eat. A lot of folks ask questions about exercise. There's a whole, especially now, we'll get to that later, right? But stress was always a big one. And then for those that, although the percentage of people that use tobacco is much lower than it was many years ago, that's a big one too, still.
Yeah.
Mm-hmm.
So as far as like nutrition, do you go in and actually have separate plans? Are there personal coaches for this? Or is this something a company would buy and they have like, I don't know, like PDFs that they send out or information that they send out?
Sure. So years ago, when I first got into this space, it was all new to me. Other than living a fairly healthy life myself, I didn't know much about how to help others to do that. And what we found was that over many, many years, they did what they thought was right. Carriers, companies, they all thought education would solve the problem. And people love education, but it doesn't really help to change behavior. So we did a lot of homework, and we found out that taking the people that I mentioned earlier and teaching them how to coach, that was the real answer, the solution to the problem. Because coaching, and I encourage everyone that's listening, wherever you can in your life, coaching works, right? So if you find someone in your life that can help you, guide you, that has the right background to do so, coaching's about, it's voluntary. So you're choosing to have someone or ask someone to help you. It's typically done at your own pace. The way we coach, we made a conscious effort to coach people where they are in their lives. So Christine, as an example, no need to tell me what's on your list. But if there's anything that you'd like to work on right now, if I were to coach you, I wouldn't come to you and tell you what to be coached on. I would ask you what you're interested in.
Sure.
A lot of coaching models, and the folks that are listening, please stay away from these, are coaching models that are telling models versus coaching people where they are in their lives right now and then helping them to move to the next healthier step. It's all about, what was that Richard Dreyfuss movie? It's all about taking baby steps, right? One little step at a time.
Right, right. Okay. All right. So, well, given our current environment, I've got to believe that you're doing a ton of coaching around nutrition and stress.
Yes.
So tell me a little bit about that.
Yeah. So people have been asking us, and there are other folks that do this. So find resources that can help your companies. We're doing one-on-one coaching, and we're finding a lot of interest out there in the marketplace for group engagement because people have been detached for so long now because of the pandemic. They're spending time with their families, they're spending time with some friends, but they're really not interacting anywhere near as much as they were before. So we're finding an interest in both one-on-one coaching to help folks with, we'll talk about nutrition and stress, and then group engagement to feel like they're actually part of something. Zoom's helping a little bit, but meetings are a lot different than doing, let's say, a Zoom cooking class or a Zoom exercise class or a Zoom where you're doing those things together. So with nutrition and stress, they're inherently connected. I didn't know this until I first started. In terms of ranking areas of risk in people's lives, Christine, nutrition, I think, is the number one, and it's 3 times larger than the next closest one, which is exercise, and then stress ties into all of it. So if you eat better, right, and you exercise often enough, it builds up your immune system. So there's a huge interest in eating better and reducing stress. And we're doing a lot of coaching around those two things, both remotely, physically, in some cases where companies still allow us to come on site, and we're getting great results. People seem to be really appreciative and thanking their companies for the opportunity to be coached on stress and nutrition throughout this pandemic.
Now, you're telling me that, so like companies that you've dealt with,
Mhm.
are they reaching out to you? And I mean, I know some of this is sometimes covered in
Yeah.
health plans, and tell me a little bit about that.
Yeah. So a lot of groups that are out there that are very strategic, forward thinking, they've been investing in this for quite some time. That said, there are really progressive carriers out there that have put aside what's they're called wellness funds, wellness dollars, wellness credits, and they encourage their groups to use them to help their folks to become healthier and safer. And typically, coaching is one of the resources that's covered in using those funds. So we're finding that some carriers there are funds available, others not so much. And then, of course, company pay is always an option. If it's really an investment in your people, because if they're healthier and safer and they come to work more often, they'll be more productive and they'll be more thankful. And we've actually seen retention numbers go up too.
All right, well, that's great. So what else are you doing right now with respect to COVID-19? You have, I'm sure you have your clients come to you for guidance on these issues surrounding COVID.
Yeah, when this all first started, we still are. We're coaching quite a bit on site. We're coaching remotely. It came from our clients first, and then we're getting a lot of requests from health benefits broker partners and consultants, because as companies started to try to figure this out, that's really what it was, right? This is all new for everyone. How do I bring people back to work more safely? What do I need to do to ensure that they're as safe as they can be when they come back? And there are protocols in place now that I'm sure a lot of the folks that are listening have heard about or read about from the CDC. We were asked by groups, hey, can you do, there are multiple categories, but other than keeping a sterile environment, wearing your mask, staying 6 feet apart, don't be anywhere near someone for more than 10 minutes if it's not 6 feet apart, all that. Things like temperature screenings and daily symptom tracking and testing. we were kind of thrown. We had to make a decision: either refer people to resources, or just dive in the pool and be a resource. So we decided to be a resource. So we can talk through those things in more detail if you like. But those are the major categories. A lot of folks are doing temperature screenings because it's an early indicator for for the infection. It's one of the most prominent. You can do that in a number of ways. Some companies have decided to go old school and have someone in PPE with a temperature gun, and when people come in the door, they take their temperature and jot down the ones that are out of normal range, and then those people are the ones that the protocol is, let HR know, go quarantine, and call your primary care provider. But now, over the last I don't know how many months, there have been a lot of companies that have entered the market that are bringing technology into play. So as companies come back to work, some of the folks listening probably already have some of these scanning devices. So you can actually put a scanner in an entryway to a building, so people can walk up to the scanner, get their temperature taken, and you can do, I think it's one person every 2 seconds.
Oh, wow.
And it does what the human, and then there's a dashboard that goes with it. It's pretty slick. Then everything migrated to daily symptom tracking so that people could be more preventive. In other words, let's say you're in your home. Let's say you had to go to an office. You go to the chamber office. Daily symptom trackers they're great tools because you can, pick up your phone, answer your questions for the day, take your own temperature at home, and if everything checks out, then you go to work. And if it doesn't, you stay home. Some companies are doing both. It's a check mechanism. You do the daily symptom tracker at home, and then you go to work and you get your temperature screened again. Some are doing that. And then there's some of these really slick scanners that can also be used as contact tracing devices. So if people are at work, they tend to be near the same people all day, most of the time, and in work groups. And if you do daily symptom tracking, you can track the source of the infection pretty easily in the workplace by using some of these devices. So there's a lot out there. We're just trying to help people navigate through it and make good decisions, and they ultimately do whatever they want. But that's what we're trying to be a resource.
Yeah.
Yeah.
Well, the contact tracing, that's really big. And now the daily symptom tracing, is that something that's an app on your phone that
It is.
you guys download?
Yeah.
Oh,
And some of the companies are building them right into the devices. So some folks are having people fill them out when they get to work.
Mm-hmm.
Some are having them when they're at home. I prefer the home method, but yeah, absolutely. And then lately we've been really busy helping people to navigate into testing, because a lot of folks, before they bring people back, they want the people to be comfortable, and they want the companies to be comfortable that people are coming back not infected. And there are multiple ways to do that, whether it's on-site PCR testing, at-home PCR testing. There's a neat test now out there that's a rapid test that can be done, and results can be provided in 15 minutes. But all that for folks that really want to make sure people are at least coming back to work not infected, knowing that they're all point-in-time tests. So you only know at any moment, do I have it now or do I not? That's the point of the testing. Yep.
Yeah. Oh, that's really, really interesting. So now, are you offering all of these services to companies?
So what we decided to do was stay true to our core. So the things that we're used to doing on site, we still do. And then we also are physically doing temperature scanning or screening ourselves. Everything else I talked about, we were asked by our clients to go out, and we vetted all the companies doing daily symptom tracking, all the companies doing or offering the scanning devices, all the companies doing testing. And we're lining up resources for organizations so they can make educated decisions. We've decided early on not to tell folks what to do, but to be educated and be able to explain everything to companies so that they can make their own strategic plans. And then we'd be glad to be a resource for them to connect resources and be involved as much as they'd like.
Okay, and you have resource pages and links as well.
Oh, yeah, of course.
Yeah. And I think we might have even placed those in the comments area, at least some of them.
Yes.
Hopefully our audience can take a look at that.
Right.
Now, how does HIPAA come into play here in this new world?
Yeah. So luckily, we're in the business that we're in. We had to be a ultra HIPAA compliant organization. HIPAA audits twice a year. So our understanding in this marketplace, meaning pandemic, there's a little bit of room with temperature screenings. So if someone walks into a building and then sticks their head in a scanner and it goes off, it's okay because we're in a pandemic. Normally, it might be a little different. So temperature screening is not that much of a concern. With testing, testing is a little different. There needs to be a release signed. So if someone does an at-home test, for instance, excuse me, they would register the test. And part of the registration is the release to share the results with someone who's HIPAA compliant at that company. So it's really important to follow all those rules because you can get in real trouble if you don't. Yeah.
Wow. Yeah, that seems difficult because personally, I'm not sure if I would want to share a lot of information with just anyone, right? So
Right.
I'm sure it's going to be.
Pardon me while I have a sip of my daily water.
So what are some of most of the employers doing to keep their employees and healthy during this time of COVID-19? Are there certain specific things that they're doing currently?
Yeah, we're finding that the first thing that really clicked was temperature screening. So a lot of folks every company that we know is doing some form of temperature screenings, whether they are doing it themselves or outsourcing it, whether they're doing it with people or with devices. So that's pretty much, from what we've seen, become a standard. Most of them have migrated into daily symptom tracking, and which comes with contact tracing mostly. And then others are right now, as a lot of folks are considering bringing people back to work. I'm seeing a lot of post-Labor Day plans. They're starting to really migrate into that whole world of testing and trying to figure it out. And a lot of folks are starting to order some form of any of those variety of tests that I mentioned.
Okay.
Yeah.
Wow. Yeah, there's a lot to think about for companies as they bring people back to work. So it's a big job, and I'm glad we have people like you out there who are familiar with everything that we need to do to make sure that everybody where we work stays safe.
We're glad to help. It's a whole new world, and we most of what we've done over the last many months has been to learn and just be a resource. So I encourage everyone listening to really, I mean, there's so much to read. We're here to help if like shortcuts, but everything. The other thing I said the other day to a group, because every day things change a little bit, and anyone that's listening that's a parent will know as you have a baby and then they grow to to a toddler and then to a child. The best advice I've ever been given as a parent is just expect everything to change all the time, and you'll be fine. That's the world we're in now. Every day, PPE resources change, PPE pricing changes, prices of nursing services hours change, testing services become limited, then they don't. The wait time for the results for testing can be 2 weeks, and then 2 weeks from now it could be 24 hours. So it's all changing all the time.
So
we have to learn how to navigate the change.
Yeah. So Gino, do you also do coaching for individuals, or is it strictly company?
From a coaching perspective, most of our coaching is one-on-one coaching that's health related, whether again it be remote or in group. And then coaching for companies is more about helping them understand strategically what all this means, and then help them. They then make their own decisions and create their own. Typically, there's an annual well-being plan developed, and we can certainly help with that. But we're not a coaching company of, let's say, coaching executives or a coaching company that coaches companies. We're a coaching company that helps people to become healthier and safer.
Okay. Okay. Good answer. So tell me, the flu is coming out now again in the fall.
Yeah,
We're going to have the flu and the pandemic. Will there be enough flu shots to go around this year?
I get that one every day. And we've went out and we vetted all the different companies that do flu shots, and we are assured by the one that we chose that they will not run out of flu shots. So I encourage all of you, when you're looking for flu shots, and it's a really good idea because they're predicting this to be one of the worst flu seasons ever, to ask that question of the provider. What's the inventory look like? Are we going? And because the last thing you want to do is plan a flu shot clinic and not have any shots.
Right.
So that's a great question.
Yeah. So what else can you tell me about the coaching process? I think that some of the coaches that I've known, we have coaches for everything, right? And I highly recommend using coaches and utilizing them for lots of different things in your life.
Yeah.
So tell me a little bit more about the coaching that you do one-on-one, and like how do you get people to be comfortable?
Sure. There's a whole process that we developed from scratch, and it starts with the company, actually. So we coach individuals, but we typically coach them at work. So in order to do that, there needs to be a process on the front end to make it a very comfortable thing to do. So typically senior leadership will buy into why they should offer this gift coaching, right? And then typically we roll this out in group sessions to explain what it is, because as you know, some of the people's largest areas of fear are around the unknown, right? And if you don't know what coaching is, people can be pretty frightened by it. So we tell them what it is, and then we tell them that we'll be on site at work to help them. And then a typical process starts with one of our coaches just getting to know you, asking you questions about yourself, what you hope to accomplish. We do motivational interviewing. The whole process is around getting to know you where you are in the moment, and then allowing you to tell the coach, which I am not, what's of interest to you. So a typical session could be talking to you if you decide early on, and typically we get 30 or 40%, I think, of people that really want to dive in, and then ultimately it could be as many as 90% of entire populations. But the 30 or 40% that dive right in typically know what they want to work on. They want to make sure that they can bond with the coach and that they click with them, and then they start asking questions about, well, how can I, if it's a conversation around nutrition, if the person's comfortable, the coach will ask them all about their daily eating habits and what does breakfast look like for you, and how do you feel before you eat breakfast, and what does lunch look like, and what do you typically feel like before you have lunch. And then ultimately they're talking and engaging and getting to know each other. And then our coaches are trained to offer small changes in people's lives, and many small changes that add up to large changes that are more sustainable. Versus, again, like I told you before, a lot of folks try to coach people into action right away, and then it usually falls off, and it's very difficult to get them back. And that's how we do it. And that's just one little example.
Right. Yeah. No. You and I had a conversation prior,
Yeah.
and I know there's just so many ways that you can be helpful, and any coach can. I mean, any help. I just recommend people, if you feel like you need somebody to give you guidance,
Sure.
for it. Yeah. And we have a question from Alice Barfield, and she's asking,
Mhm.
what do you recommend companies do to ensure they do not have any employees that are asymptomatic spreaders?
Yeah. Well, unfortunately, the only way to know for sure if there's an asymptomatic spreader amongst they're calling it a herd, is to test. And that's why there's been so much talk around and debate around testing, right? And that's why folks decide to do the testing on the front end, because it's the only way to detect that. But the difficult part is an asymptomatic spreader today, it could be you, and then if you don't test again for X number of days or weeks, There could be a whole bunch of others that may have all potentially spread the virus in the interim. So it's a tricky virus because you can be at home, go to a CVS or go to Wegmans and pick the virus up and come home, and it doesn't present itself for a few days. And an asymptomatic uh, scenario doesn't show at all. But then you could be carrying this thing for a couple of weeks, and then did you see? I had a flashback. I don't have it here, but do you remember seeing? It was on social media. Remember the old game Pong, where the
Yeah.
ball,
Yeah.
right? Did you see that visual that came out from the CDC?
Yes.
Where one ball hit another ball, then it turned into two more, and then those two had, and then that's how it was the greatest visual for how a virus spreads that I've ever
Yeah,
seen.
it did. It opened my eyes as well. I saw when I saw that, I was like, wow, I didn't think of it that way. And it
Yeah.
was simple,
So
right?
the only way to prevent that is to know in the herd
Mhm.
who that spreader is and quarantine them for that 14 days. That's the only way. Now, in industries that are out there now, it completely varies in terms of the frequency of testing, if they test at all. And again, we're not telling anyone to test. Nursing homes, managed care facilities are testing a few times a week because they're among a very high-risk population. So we're seeing a lot of that. Folks in manufacturing that are food manufacturing, places like that, more frequent. It completely varies. It's like I said, everything changes constantly.
Yeah, I'm wondering how companies are going to deal with it if they do decide to bring people back into the office because
Yeah,
without testing or testing often,
right.
you could have those asymptomatic people spreading it. And
Yeah, or often enough, right? Was it last week? Yeah, it was last week. There's a company, they have 40. This is another piece of the puzzle, right? So the companies how about people that have to be client facing, right? If you're in an industry where you have to send people to interface with other folks. This company decided they wanted each of their 40 interfacing individuals to have 10 at-home kits, and they're to do one days enough before their appointments, because the turnaround time is only a couple days for those. But that was one strategy that one company decided to pursue.
yeah, and I mean that I would think is something a lot of companies are going to have to do eventually, especially if they want one-on-one meetings with people.
Right. Yeah,
They're
exactly.
going to do that type of tracing.
Right.
So, wow. So tell me a little bit more about. I'm going keep going back to the coaching because I think the coaching part of what you all do is so
Sure.
important.
Yeah.
And during this pandemic, we touched a little bit on the stress portion of the coaching.
Mm-hmm.
How much more difficult is it now? One, being in a pandemic, having to deal with people probably via Zoom. And what are the stress levels or the stresses that you're hearing about from your clients?
Yeah, they're typically very high right now, which lends itself to needing more guidance or coaching with nutrition and stress. Stress, they're connected, right? So if you don't eat well and you don't exercise, you get more stressed. And when you're more stressed, your body releases cortisol. Exercise releases endorphins, which reduce cortisol. So exercise comes into play too, right? So we're doing a lot. I'm not, again, I keep qualifying. I don't want, and I really appreciate our coaches. I coach sports, but I'm not a wellness coach. They're coaching a lot around resiliency and mindfulness as tied to the stresses during the pandemic. So there's actually coaching around mindfulness and resiliency, which lends itself to helping people to be more mindful about what they're going to eat and plan better and be more mindful about when they should exercise and finding a time of the day that actually works for them that they can stick to. And then if those two things happen, stress levels come down and then people feel a lot better and they're not doing the things that are harming them as much.
Yeah.
So
Gene, it sounds so simple.
Yeah.
It sounds real simple because I know I have that, I'm told all the time to do my exercising and, eat well. And for some reason, it is hard to get fitted into your day. So these people who go to the coaches, they're very fortunate because that coach, I would imagine, stays on them and teaches them and gives them that guidance. But I think we're almost out of time for today. So Yeah, so that went fast, Gene. So thank you so much for being with us. I really do appreciate your time and all the great information that you were able to provide. I'd also like to thank April Sede and New Jersey Buzz Productions. If you're not familiar with New Jersey Buzz, I highly recommend you following the Buzz on Facebook. Thank you all for tuning in. I do hope you will join us again Tuesday, September 22nd at 12:30 p.m. for our next Chamber Live broadcast. Thanks again, Gene. It was great chatting with you.
Thanks, Christine. I enjoyed it.
You're
Have a great
welcome. Have a great day, everyone.